Surgery becomes an option after medical therapy has no longer provided the results that the patient is looking for, or they have recurrent and chronic symptoms going along with those. Typically, we will look for symptoms to be present for greater than 3 months and to have signs of underlying inflammation during what's called a nasal endoscopy, which is performed during an office visit, or on imaging, which shows inflammation within the sinuses. Sinus surgery is overall a relatively safe procedure. It is done under general anesthesia, so the patient is asleep for the procedure, and is done on an outpatient basis. As with all surgeries, there are certain risks associated with sinus surgery. These can include infection and bleeding, along with specific risks for sinus surgery, which include injury to the eye, which can result in blurry vision, double vision, or loss of vision. Those are typically very rare complications, as well as the potential for injury to the bone that separates the sinuses from the brain. That can cause what we call a CSF, or cerebrospinal fluid link. Again, that is very rare. So recovery time within the sinuses can typically last up to 6 weeks. I typically tell my patients that within the first 1 to 2 weeks, they will feel like they're back on their feet and back to their regular activities. Although when we look inside the nose following the surgery, we'll see that there is ongoing healing that lasts up to 6 weeks. Most people, though, however, are back to their usual activities within that first week. And for adults, they're typically back to work by the end of that first week. Sinusitis is often a lifelong issue. Surgery is considered part of the treatment therapy for sinusitis. So although surgery itself does not offer a cure for underlying sinusitis, oftentimes it does help improve symptom control. And following surgery, we typically will still continue to medically manage patients with topical nasal steroids and saline rinses.